Hi and welcome. Do you want to know how to minimize the risk of back injury even if you're training hard or working long hours? Or if you're already injured and want to find the best way of supporting your healing? In this short video clip, I will share with you the secrets I have used during my 30 years of successful clinical practice at the Living Centre Clinic in London. I will share with you why I have grown a reputation for fixing back pain, which other clinicians may have failed to fix, and also to show you how to fix pain that's been there for a long time. You will discover how to manage back pain in the comfort of your own home, office or gym. Now, before we start, the first thing to mention is that there is actually no cure for preventing back pain once you have it. True, there are many exercises which can improve back pain, but none of these actually prevent or cure back pain, period. So, in the absence of a cure, and since the late 1980s, medical textbooks talk about back pain management rather than back pain treatment. In simple words, it's a euphemism for changing your lifestyle. It is for this reason why many people encounter a cycle of remission and relapse, or simply fail to shake off an old injury which goes on and becomes chronic. Lifestyle is critical to this change. So what exactly does that mean? I have identified for you what I believe are the critical elements to boosting not just health, but also to decrease stress and increase your constitutional health. These are sleep, routine, and exercise. I will explain. It is not widely known, but the genes for healing are most active during the night. Resting or lying down in the day does not afford the same level of healing. Though rest is clearly important, healing goes into turbo mode at night when you are asleep. However, we need to be aware that this effect can be neutralized by the body releasing wake-up hormones. These are generally released 1 to 2 hours before we wake up. So if you're going to bed the wrong side of midnight, your body needs to go to sleep, followed by deep sleep, and then and only then will the healing genes be switched on. But if shortly after the genes have been switched on, your body starts to release wake-up hormones, it's clear to see that your healing is going to get the short straw. Or simply put, your body misses out on the full amount of healing which it may desperately need. So, go to bed extra early for 1 week at least. Imagine if you were to sleep an hour earlier each day, say over a week, your body would get the equivalent of a whole night's sleep. And incidentally, sleep also washes the brain and freshens the mind. It is proven to help with weight loss as well. So the take-home message here, give it a try. Try 1 week of early nights and see the difference for yourself. Once you experience the healing power of sleep, you will be the first to want to opt for it again and again. Now, the second point is actually routine. Your body has a clock. We all have a body clock, and it switches many processes on and off in our lives. The more consistent it works, the better our health. And like any clock, it needs to keep good time for optimal benefits. The best known example of what happens when the body clock goes wrong is, of course, jet lag. Your wake-up hormones are suddenly released at the wrong time, usually in the middle of the night when you do want to sleep. And similarly, it's no different for our healing. Each of the body clocks are collectively known as your biological rhythms, known commonly as your biorhythms. It works best when the body is in a regular routine. The best example of this is, of course, a newborn baby. We all know it will thrive if you feed it at a certain time, sleep it at a certain time, and play with it at a certain time. And giving a baby routine means it is free to grow and develop. And so it is the same for us as adults. In the same way, when we are undergoing injury, strain or stress in our lives, the more in sync we are with our biorhythms, the more effective our healing clock will be. To achieve this, it really does mean clearing or reducing the workload in your work diary or social diary, or both. Getting early nights and effectively allowing yourself extra time to relax and regroup will make all the difference. The take-home message is that your biorhythms are lifelong. So when you are knocked off balance, getting back into sync with your biorhythms is a great way to help you get back on your feet again. So give it a go. Try a week of early nights, as I have said, and get back into routine. And that includes the routine of eating, sleeping and playing, all in a balanced way. And if you want a little guidance, just think of how you would manage that newborn baby. Like food, we need a balance of different exercises to keep healthy or to shake off a stubborn injury. True, there is a place for specific exercises aimed at specifically working an injured tissue, but unless you know what you are doing, these are generally to be avoided. Always go for cross-training to work out the different body parts. Now, the reason this is important is because even when you are working a body part that is not directly injured, under the radar, the injured area also gets a workout. This secondary effect, over time, will gently bring your body's harmony back to balance. Equally important is to allow your body a rest period in between exercises. This is called the adaptation phase. It is one of the reasons why muscle men of the 1920s like Charles Atlas looked proportionately less developed compared with the 1970 muscle men like Arnold Schwarzenegger. So if an area is injured, it may take a longer adaptation phase. So in some cases this means exercising only 1 to 2 times a week to start with. This could also include the little and often principle. For most people, I clinically recommend exercising for around 20 minutes and at 60% of what they might normally do. And combined with at least 2 to 3 days of rest per week, in a few weeks' time, most people can shake off their injury while still training. And finally, a word about the type of exercise. Apart from exercise variety, it is important to get the balance between muscle strength and joint flexibility. And do keep in mind that tall trees bend in the wind and stiff trees break. In the same way, developing strong, powerful muscles on a stiff backbone is likely to lead to damage sooner or later. And on the other side of the coin, I see many patients who seem obsessed with stretching. Aim only to restore lost length in muscle. Remember, an over-flexible joint is also prone to injury. Build a variety of exercises into your exercise program and include different body parts as well. Number 2. Rest between training to allow for tissue repair or adaptation. And number 3, keep in mind the need to balance flexibility with strength. And finally, I appreciate this is a big ask for some people. We all want to take shortcuts. People may accomplish some of this process, part of the process, or just simply stop too soon. It is a long journey, but if you follow these principles and provided there is no underlying medical issue, eventually and with time, you can't help but get better, even if it is slow. Good luck.